Hello, my name is Alexis Hester, current ultrasound technician at St. Francis Hospital, and today I'll be doing a recommendation report on wireless ultrasound machines. Yes, a wireless ultrasound machine. Sounds intriguing, right? Let's get into the history. What is an ultrasound? Ultrasound is a diagnostic imaging technique which uses sound waves to produce images of internal structures. What is used to perform these ultrasound is an ultrasound machine. It's usually big and bulky, usually stationary and non-mobile. Some move a little bit around the room, but for the most part, it's non-mobile. Some important parts of the ultrasound machine is the monitor, where we see the pictures at, the keyboard, the processor, the data unit storage, and then we have the main important part here is the probe. That's where that's the part where that we put on the jelly when we're trying to see things. So the transducer actually is used to send echoes. That's his first job. It sends the echoes. His second job is the echoes are then, or sound waves are then bounced back off the object of a dense object that is seen, and then it reports a picture back on the screen. So the transducer has two jobs. So the purpose of this report is to recommend wireless ultrasounds to the OBGYN or radiology department of St. Francis Hospital. First reason is that it reduces appointment time and our visit time. It reduces pre and post cleaning procedures. It helps with ER wait time and possible emergencies. It brings the department to speed with the new medical advancements. Is change always good? Change is always good if it's for the better. I always believe that. Some say that change is not good, but change is always good for the better. And this, it's all about time. It's reducing time, and reducing time, we are then helping patients better. And if the patients are being assisted faster, some things can be prevented or some things can be seen earlier than previously. So due to current COVID restrictions, I was not able to obtain the primary research portion through the use of an interview. Instead, I came up with results based on the research done on the given topic. When comparing and contrasting, there were some more positive than there was negative. The only negatives I really came across was initially when the product first came out a couple years ago. You know how a product first starts, there's always some nicks and stuff that you have to improve. There was things of such of the quality of the picture, the speed of the waves being sent. It just the Wi-Fi capability. It was just a lot of different things that kind of steer you away from, you know, going this route. And also the price. The price was also a problem. You know, it was something new, so the prices were a little bit higher. Some of the good, some of the positives to it is now and prior is that it saves time, because basically it's a small object similar to a remote, and then you would take this object here and you will see the pictures on. So both wireless objects that you'll be using. So again, it'll be less cleaning, less touching things, less contaminated, less things in the actual room that you're seeing the patients in, and things of that sort. Excuse me. So here's a picture of the two, and again, like I was stating, this is the object here, and as we all know, this is the stationary one right here. Okay, so in conclusion, with the good and the bad characteristics, I do believe the wireless machine is the best option. Again, now as time went on, the prices are actually good. The wireless prices are between $10,000 and $50,000, whereas though the stationary products are $20,000 to $75,000. I mean, just imagine, the machines are pretty big and bulky, so it makes sense that they cost more. This is another positive to the small ultrasound machine, is that it actually costs less. But in replacing a whole hospital, it would initially cost more, because you have to get rid of the old and bring all in the new. Okay, so for the final recommendations, so this is for the board of directors and the head of the OBGYN. I think there should be a discussion with the budgeting and what is best for the department moving forward, as far as how many should be started with and how we're going to wean on to totally, excuse me, totally switching over to the wireless portable ultrasound machine. There should also be limited training in how to use the machine, because when anything new is brought, especially something of this nature, when for as many years as we can think of, we've been using the actual machine, standard machine, it's going to take time to get used to, take time using and things like that. And last but not least, the final recommendation, wireless portable ultrasound machines should be implemented across the board due to it being the most efficient way to assist the patients, excuse me. So with that being said, that's my final recommendation. I do recommend these wireless ultrasound machines, and you can take a better look here and see what they're about. Thank you.